Shigella dysentery is a bacteria that is classified as a gamma protobacteria. It's from the family of the Enterobacteriaceae. It is a rod-shaped bacteria, and its species can cause shigellosis, bacillary dysentery. This bacteria is a gram-negative, non-spore-forming, facultatively anaerobic, non-motile bacteria. This bacteria attacks mostly the GI tract by giving you a really severe dysentery. By dysentery, I mean inflammation of the intestines, and it's mainly accompanied by severe diarrhea with blood in it. It also attacks the lungs and the heart, the nervous system of the patient in severe cases, and it usually gives the patient anemia. It's accompanied by really, really bad fevers. Really, really bad fever. Painful stomach aches. It's most commonly known as food poisoning. Also sometimes a stomach bug. Due to its deadly toxin, the shigella toxin, it also causes in severe cases severe colitis, malnutrition, and rectal prolapse, even reactive arthritis. Its virulence factor is the lipopolysaccharides molecules. They consist of a lipid and a polysaccharide made out of O antigens in the outer and inner core, joined by a covalent bond. They're found in the outer membrane of the gram-negative bacteria, and they provoke a very strong immune system, mainly in animals. Shigella is resistant to ampicillin, trimethoprim, sulfamethylazole, and nalidixic acid. Some of the treatment that you could use may include the ciprofloxacin, the azithromycin, and the ceftriaxone. These are mainly used just to control the symptoms, and you can't really attack the bacteria. It's just something you gotta let it run the course of. But they give you treatment for the symptoms to try to lower them down and help you go through the process. The morphology of this bacteria by itself, it's, like I said, it's a rod-shaped bacteria. It's a short gram-negative bacilli, fimbrate, non-motile, non-sporting, and non-capsular end. It's pretty much it from that. As its colony, they are aerobes and facultative anaerobes. They grow best at 37 degrees. Its pH is of 7.4, and on ordinary media colonies, they're small. They're about 2 millimeters in diameter. They're circular and they're convex. They're smooth and they're really transparent, as you could see here. They're really, really like a water drop, I guess you could say. They are colorless, so there's not much of a wow factor to their colonies. Okay, the most commonly selective media that it is used for this bacteria is the XLD, and that gives you this when it is smeared and done. They also use the DCA agar and the Helton enteric agar. When it's stained, this is what it mainly looks like. This typical bacteria, it is transmitted by the use of contaminated water, contaminated food, and by touching with dirty hands, other objects like your food or something that you're going to bring to your mouth. Unwashed hands that prepare food, or dirty hands that you just put, bite your nails or put it into your mouth, can cause this bacteria to be digested. That is why it mainly attacks your GI tract and all your intestines and everything, because that's, you're swallowing and it all goes through there. Okay, let's talk about the rates. Infection rates, they range from 1% to 33%. Excuse my numbers. Of cases that are severe cases that are recorded in the US a year. From 1% to 7% of these cases end up in a death. And they range from, most of the deaths are ranging from the ages of 1 through 5, and people or elderly people ranging from the 60 to the 80 years of age. I think this is now gonna make me think twice before I buy food anywhere but my house, or that I've cooked myself. You never know what you could find out there. And to this, I just want to say thank you for taking the time in looking at this presentation. Thank you, guys.